All right, this is Ed Weir, former manager of the Social Security Administration. I am going to, usually I do a topic for about 10 or 15 minutes, talk about different things, Social Security, Medicare, survivor benefits, spouse benefits, disability, and all the rest of it. But today I am just going to answer questions. I had a pretty popular video I did yesterday and the day before, and I got a lot of people that joined and asked questions, and I just didn't have enough time. So I figured today I'll just answer questions the entire time. So for about an hour here. So if you've got any questions, just go ahead and type them there in the remarks, and we'll get to as many as humanly possible. Let me get all set up here. There's no fancy studios and all the extra staff and all that kind of good stuff. This is pretty much a one-man operation. So let's see what we got here. All right, Taken Took. Hey, what's up, Taken? Have you had a chance to see the wording of the Stop Corporate Capture Act that Elizabeth Warren introduced today? No, I haven't seen that one yet. Anything missing I should know? I should ask my senator about adding. I will definitely check that out. All right, let's see. All right. Hog fan boy. Okay. All right. Read a Newsweek article yesterday. It said 2025 Part D max of 2000 might mean some employer plans may not qualify replacement for those working past 65 and might get surprised with penalty. Yeah. In order to be an allowable plan, so you don't have to sign up, for Part B and stuff like that. When you turn 65, you're supposed to sign up for Part B, but you don't have to when you're 65, or if you're eligible for Medicare, after you're on disability for 2 years, if you have health insurance from work, comparable health insurance from work. So there are some, workplaces that just say, it's like, pay $50 and if anything happens, we'll give you a Band-Aid. That's not comparable coverage, but most places out there are. But if you have health insurance from work, yours or your spouse's, and your employer has 20 or more employees on that plan, then you do not have to sign up for Part B. You hear all the time people say, hey, if you don't sign up for Part B when you're supposed to, you're going to get penalized, and you get penalized for the rest of your life. That is 100% true. But they often don't say that. However, you don't have to sign up if you have health insurance from current work. That's the key. It has to be current work. It can't be COBRA. Obamacare doesn't count as that. It can't be a retirement plan. It can't be, VA medical and stuff like that. It has to be from current work, yours or your spouse's. So if you have that, again, 20 or more employees, then you do not have to sign up for Part B. You can delay it. You can sign up for Part A if you want to, unless you're contributing to an HSA, a health savings account. If you have a health savings account, you have to stop contributing 6 months before you sign up for Part A. But if you don't, you can sign up for Part A or not, whatever. But Part B, to avoid the penalty, again, current work. And then 5 years later, 10 years later, 20 years later, whenever the case may be, you stop working, your spouse stops working, you stop receiving health insurance from current employment, then you have 8 months. Legally, you have 8 months to sign up for Part B and avoid the penalty. But been doing this for a few decades. What happens when you don't have health insurance for 8 months or 8 days? So I always recommend about a month or two, you're going to lose your health insurance from current work. Then you go ahead and contact Social Security and get signed up for Medicare Part B. And there's a couple of forms you'll need, a 40B and a 564. Pretty easy. Got them on, get them on Google. And one of those you take to your employer, and your employer fills them out all the time. So I'm sure they know what to do. It's basically proof that you did indeed have health insurance from work since you turned 65. So your employer fills it out. Yeah. This person had health insurance through their employment or their spouse employment since they're 65. Don't penalize them. And then you just take that to Social Security, and Social Security just made it an option where you can do it online. So they've finally, Social Security is finally joining the 18th century and trying to make a lot more stuff online. So you can do it online and get your Part B all signed up for, and no penalty whatsoever. But that has to be kind of comparable coverage and stuff like that. And then you have to figure out what you're going to do to cover all the gaps. Because right now, original Medicare Part A and Part B has lots of gaps. The big one is the Part B, which is the doctors. Part A is the hospital, Part B is the doctors. So if you have like $100,000 surgery, you have to pay 20%. So you have to pay $20,000 out of your pocket. So what people do is they get something to cover those gaps, and the options are a Medicare supplement plan, those are the N's and the G's, or a Medicare Advantage plan. So one of those options, and I've got lots of videos on the differences between the Medicare supplement plans and the differences between Medicare Advantage and Medicare supplement and all the rest of it. And because there's so many people out there that are kind of bad actors in that whole field, I have decided to put together a team. So if you need help enrolling in a Medicare plan, Advantage, or supplement, dental, vision, just make sure you click on the little button there where it says get more help, and we can have someone reach out to you and help you out. And there's also going to be a lot of changes coming up in 2025. And you're talking about the Inflation Reduction Act and everything. That is going to affect everybody, pretty much. If you have a Medicare supplement plan, that means you have a separate Part D plan, and your Part D plan is going to change. A lot of people signed up for those 0 premium or 50-cent premium Part D plans this year. Yeah, those are gone. That's gone. Hope you enjoyed them while you had them. It's all going to change next year. And then Medicare Advantage, most of those come wrapped up with a Part D embedded in the Medicare Advantage plan. And those are going to change. There's going to be massive changes for 2025 based on the Inflation Reduction Act, new regulations that are coming down. CMS is going to start paying some of these companies less. A lot of companies have already notified CMS and other places, Wall Street, that they're going to be pulling out of particular areas that they don't make enough money. So 2025, if you haven't checked your Medicare plan in a few years, now's the time to do it. Because remember, those are only good for 1 year. You're like, hey, I've had my plan for 2 or 3 years. No, you haven't. You've had it for 6-7 months. Every plan changes. It goes away December 31st at midnight. Why is it that people on SSI can't have more than $2,000 in their checking account? Because SSI is a welfare-based program. If you got a whole bunch of money in your checking account, then you don't need welfare. So it's $2,000 for a single, $3,000 for a couple. Does taking Social Security at 62 affect my future survivor benefits amount? Yes, because your survivor benefit amount is based on essentially what you were receiving. So if you took it very early, then it could very well affect survivor benefits. And if you took it late, then get those delayed retirement credits. Then your surviving spouse essentially gets kind of what you were receiving if they start their benefits at their full retirement age. So yeah, survivor benefits calculations are a little bit strange. Everything else, like disability, spouse benefits, it's all based on the PIA, which is the primary insurance amount, which is your benefit amount at your full retirement age. But if you take survivor benefits early or late, then that could have very well affect survivor, your surviving spouse. Yes. Let's see. Question, please. Is there anyone in your office? It's for Social Security. It's just me. I do have people to help with Medicare, and my son helps me with all the other kind of. But yeah, in terms of Social Security, it's just me. Is there anyone in your office to help make a decision on best way to take our pension? 100%. Maybe do a pop-up. Some advice helps. Thanks. Take a pension. Are we talking about a private pension? Or are you talking about Social Security? I do offer 99.9% of my help is free here. My team that I use, they help you with Medicare supplements and Medicare Advantage. Their help is 100% free. I've got people that can help you with Obamacare. They help 100% for free. I do all these pretty much on a daily basis, 100% for free. But I do have an option of a private call. So let me go ahead and pop that in there. So if you want a private call, and just schedule an appointment there, and we can talk about your particular case. But I charge for those to pay for everything else, all this great overhead we have here. All right, let's see here. Let's see. I got a lot of questions. All right, good. Which is the best way to start SSA benefits, such as phone appointment, online? Also, can I get Part D when I use your people as my broker? Yes, definitely help. Yeah, they can help you with Part D. The best way to go ahead and start your benefits for retirement benefits, spouse benefits, disability benefits, internet. If you're good with the internet, then definitely on disability, I definitely recommend the internet. That way you can take your own time. If you're relatively good on the internet, it's pretty easy for the first couple of stages. Retirement, internet. But remember, the most important thing, I want to make sure I tell this every single time. When you file for benefits, when I took the hundreds of thousands of retirement claims I did, before COVID, people would come into the office and we would print off their work history. I'd grab it off the printer and they'd be sitting right in front of me, and I'd show them their work history they did all their entire life. And I would say, does it all look good? So that is extremely important. But unfortunately, we've lost that with internet and phone appointments. So the reason you do that is because your benefit amount is based on your high 35 years of earnings. And if Social Security does not have your earnings correct, then you're not getting the correct benefit for the rest of your life. So it's important that your earnings record is correct. So if you're going to file a line, fine. But make sure you go into, when you're online there, go to My Social Security, and check your earnings record and make sure it's correct. And if you've got a military service, make sure you have, you put your military service down there. But it's pretty easy. But if you're not good with that, just, you schedule an appointment, a phone appointment or in-office appointment. Usually they like phone appointments nowadays. And they'll call you at whatever time on whatever date you pick and do everything on the phone. And if you need any proofs, birth certificate, anything like that, usually you don't. They changed the regulations a few years ago to make it easy. If you're born in the United States and everything is correct on your Social Security record, your name, your obviously Social Security number, your date of birth, and all that kind of stuff, then it's all good. You're like, well, my Social Security card doesn't have my date of birth. Yes, it does. It just doesn't have it on the card. It has everything on the inside. It has the city, state you were born, your parents' name, your mother's maiden name. That's everything internal on the Social Security card. Let's see here. SSA refuses Freedom of Infraction requests for my SS records. What next, Inspector General? Yeah, it's interesting that a FOIA request for your Social Security records. So I wonder what type of records and medical records. Sometimes medical records, if doctors say do not release medical records to this individual because of whatever reason, mental issues. I'm sure that's not you, but sometimes, yeah, Social Security kind of abides by that. But yeah, FOIA request. Yeah, I'd call Inspector General or your politician, your federal politician, and say, hey, what's going on here? So freedom of information. It's not as though you're requesting, who shot Kennedy or something. It's your medical records. Is it better to start your Social Security at the beginning of the year, or does it matter? No, it doesn't matter, really. It really depends on your work. A lot of people think that, they don't get the extra bump until their birthday month and they have to apply on their birthday, or they have to wait an entire 12 years to get, that COLA and all kinds of weird things. Yeah, no. Every month you wait, your benefit goes up, for full retirement. Even after full retirement, up until 70, every month you wait, your benefits go up. So it doesn't matter whether it's first of the year, middle of the year, end of the year. But it does matter if your earnings record, if you're filing for early retirement, then obviously, it matters because you have to stay under the yearly limit, the 22,320. And if you're over that, remember, you can switch to a monthly limit. Always take any additional money out of your bank ASAP. It is nice to have a little cash in the house. Let's see here. I lost my SSDI due to going over SGA 1 month, and they are stating I am not going to get it my reconsideration. So should I try and work full time since I'm off SSDI? Well, yeah, if you're off SSDI now, if they've stopped your benefits, then yeah, so you can do whatever you want. You're completely free to do whatever you want. But wonder why they stopped your SSDI, because remember, you've got the trial work period, that 9 months, so you must have already exhausted that. And then you've got the extended period of eligibility, a 36-month period. Any month you go over SGA, the substantial gainful activity, $1,550, then they stop that month. So if you're in your EPE and you went over 1 month and they stop that 1 month, then they should start it the next month unless you continue to go over. So I would confirm whether it just stopped for 1 month or whether they're talking about it's for stopping forever for some other reason. I would confirm that before I made a decision. But if you can go back to work and you're going to make a lot more money, working, and you can do it, then hey, more power to you. And remember, you do have you do have an EXR ability. So if you go back to work and they stop your Social Security because of work, remember, within 5 years, if you just keep trying to work, and you're just not able to do it, then you can reapply what's called an EXR, Expedited Reinstatement, and they can restart your benefits. But it has to be the same disability, and you had to have stopped receiving benefits because of work, and it has to be within 5 years. So I'm planning to move overseas. I'm on SSDI. How do I tackle the review if my doctor will be overseas? What kind of question goes on a review? I had a work review. Is that the same? No. Yeah. So there's a couple of different CDRs, continuing disability reviews. You have a medical CDR and a work CDR. So work CDR is just as the name implies. They check your work and see if you're going over SGA and trial work periods and all that kind of good stuff. But if a medical CDR, yeah, your doctor and stuff like that, a medical CDR is they review your disability to see if your disability has improved. And, if you've got a doctor overseas, but yeah, they usually don't accept overseas doctors necessarily. But yeah, on a medical CDR, they might have you do a CE, which is a consultative exam with a Social Security contracted, doctor. So yeah, if you're overseas, you're not going to be able to get that. So, I mean, you have every right to whatever medical records you have from an overseas doctor. You can definitely include that in the medical CDR once you get it. If I have a state teacher pension of approximately $1,500 and a reduced Social Security of approximately $250, what happens to my income if my husband passes? He receives about $2,300. Yeah, so you're under the windfall elimination provision that you worked in a non-covered entity, a state, local, city government, and the WEP, the windfall elimination provision, reduces, or it actually doesn't reduce it, calculates your benefit correctly, just like everybody else's, doesn't give you the extra welfare benefit. And the GPO is the government pension offset that recalculates the benefits you would receive off of a spouse. Everybody else that receives Social Security, they get what they receive reduced from what they receive from a spouse. And the GPO makes it fair that you do as well. So yeah, that will affect 2/3 of your non-covered pension will affect how much you receive from your deceased spouse. Match point. May I claim my Social Security at 62? Then once my ex-spouse is 62, I'll be 69. Claim the ex-spouse benefit. Yes. I worry that I'll be locked into my amount if I start there. Yes, you will be locked into your amount if you start at 62. But if your spouse turns 62 when you're 69, then you're at your full retirement age. So you will receive 50% of that person's primary insurance amount. So that won't be locked in because, yeah, one doesn't lock in the other. Let's see. What do I need to visit my Social Security office to receive part of my ex-husband's Social Security and my Social Security check? We were married 24 years, both remarried, but I never signed up for part of his. Okay, wow. Yeah. So um, hopefully you didn't lose too much money there. Um, so you've already checked to make sure you're entitled to more benefits, that there are more benefits there. So it sounds like you're good there. Um, and then all you need is your marriage certificate and your divorce decree to prove the 10-year marriage. And it has to be the original documentation. I'm not the original from, 10, 20, 30 years ago. It's an original document from the issuing agency, whatever, state, county, city, that, you know, marriage certificate. And then the divorce decree usually has a little red stamp or raised seal or something like that. So it has to be the originals. And you hand those to them. They make copies. You can't provide copies. They make the copies, and then they give your originals right back to you. So, and you're already receiving benefits, so you don't need your birth certificate. So you just need your marriage certificate, divorce decree, and your bank information. But since you're already receiving the information, that you're already receiving benefits, they already have your routing number, account number. So that is it. And make sure they treat you right, and make sure you have an appointment. If you're just going to go walk in, then yeah, it's depending on your office, you might be waiting a long time. So it's always good to schedule an appointment. And if you go ahead and schedule an appointment now, you probably won't get it till next month and the month after, but you're not going to be losing anything. If you call them now, you're immediately protected. So it's, if you file next month or 2 months down the line, you can say, okay, start my benefits when I called you. And remember, if you called them before and for whatever reason they dropped the ball and they told you there's no more money there or whatever the case may be, then you correct them and say, hey, I called you all 6 months ago and I asked you about this and you told me X, Y, or Z, and that's wrong. And now I'm getting money. I want my check to start 6 months ago when I first called you about this. So it's called protective filing. How many expedited hearings are you allowed after losing your SSDI in 5 years following the ceasement? Yeah, it's not a hearing. Expedited reinstatement, EXR. How many are you allowed? Yeah, you only need one. Yeah, you only need one. It's just you're you're restarting your benefits because you have the same disability and your benefits were stopped within the 5-year period because of work. So it's not a hearing, it's just an application. And full disclosure, Social Security employees hate EXRs, not because they don't like the policy or thing like that. It's just EXRs are really a terrible. There's a lot of paperwork and a lot of stuff, and people and the Social Security employees don't get very many of them, so they probably get maybe 3 or 4 a year. So every time they get another one, they have to relearn how to. Okay, was I supposed to check here? And what about this? And so yeah, so when the Social Security employee looks like they're not very happy, don't take it personal. It's just the internal EXR system. What's the technical word? Sucks. Can someone who retires before age 65 with worker coverage that do? Yes. Okay, I'm not sure what that question is. I did my consultative exam. DDS called me and said they need medical records from my doctor. Is good. Okay. All right. So they want some other stuff. They're, for some reason, they're not buying everything, or they need more information from your doctor to fill in the consultative exam gaps, I guess. So, all right, let's see. If someone retires before age 65 with worker coverage that will not provide for okay, getting partial questions here. When does SSDI change to regular Social Security retirement? I turned 64 in September and have been on SSDI since. Yes, it changes to regular retirement at your full retirement age. So everybody in the country that is receiving disability, they will automatically be switched to regular retirement benefits at their full retirement age. Full retirement age, 66 and 8 months, 10 months, 67, or whatever the case may be. And most people don't even recognize that they've been switched to regular retirement because the check stays the same and everything. And there's a lot of people out there, unfortunately. That's why I want you to subscribe and share and like and do all that kind of stuff and teach this, YouTube and TikTok and all these dumb computer algorithms that this is important information. because there's a lot of people out there that are 66, 67, 70, 75, and they're like, yeah, I really like to work. I'm feeling a lot better. I can work, but I'm on disability, so I can't work, and I don't want my disability to stop. No, 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 you're no longer on disability anymore. You're on regular retirement. You can do anything you want. You can go out there and join the Olympics, make $1 billion a month. It's no problem whatsoever. But there's a lot of people out there suffering because they think they can't go get a part-time job and help pay the rent because they're on disability. No, they're not on disability after their full retirement age. So please like and subscribe and all that kind of good stuff. We need to get this information out there. I turned 65 in December, currently on an Advantage plan due to disability. I signed up for a Medigap plan in December and will be signing up for Part D drug plan in September. How do I cancel the Advantage? That's automatic. Yeah, once you, well, it's not kind of automatic. I would reach out. So you're going to go ahead. You've already signed up for the Medigap. So good, good, good. I always recommend that because most states, if you're on disability under 65, then the states don't demand Medicare supplement companies to give you a Medicare supplement plan. You can get a Medicare Advantage plan, and that's what most people do is get a Medicare Advantage plan. Unfortunately, they have pre-authorizations and networks, and some people just don't like them. And they want a Medicare supplement, but they can't get one. But once they hit 65, they're in that golden window where they can get any Medicare supplement plan. There's no, pre-existing conditions or extra, fees or anything like that. So that's what James did. Smart, smart, smart. Now he can go to any doctor or hospital or clinic in the country that takes Medicare. He doesn't have to ask the insurance company, hey, me and my doctor decided we want to do this. And, you don't have to get authorizations. So awesome. So yes, I would probably, so your Medicare Advantage, or excuse me, your Medicare supplement is going to start in December. So I would reach out to him and just tell him not to renew it. And then yes, you will need to get a prescription drug plan as well if you haven't already. I will be 5 months without insurance till I turn 65. Will I be penalized? Nope, nope. It's only after. Do not think I can afford Obamacare until I turn 65. Yeah. Remember that on Obamacare, there's a bunch of subsidies. They're pre-tax credits type thing, and cost sharing. Bobby, my husband started Social Security via phone. I went into the office. Both worked just fine. Perfect. Good, good, good. When they tell you how much money you can earn, does that include your Social Security or is that beside your Social Security? That does not include your Social Security. So when you're talking about, the annual earnings limit for Social Security, $22,320, it's only earned income. So if it's an inheritance, that doesn't count. If it's your Social Security benefits, that doesn't count. If it's workers' comp, that doesn't count. If it's your 401 pension, or or you make you win $1 billion gambling, unless you're a professional gambler and that's your job. But if you just buy a scratcher and make $1 billion, then that you're good. And then make sure you buy me a coffee or a beer. All right. Okay, I already answered that one. Can you stop an expedited hearing so it will not count? I'm thinking of trying to work full time since I got my SSI due to going over SGA 1 month from 123. Yeah, again, it's that's strange that they would stop it. They don't stop it for that. They stop it for that 1 month, but then they'll start it again the following month. But yeah, if you want to go back to work and you've already filed an expedited reinstatement, an EXR, then you can tell them, says, you know what? I wanted to go ahead and restart my benefits because my disability, I still can't work because of my disability. And what you're saying now is, you know what, I think I can work with my I can work through my disability. And so I don't want to do the XR. Yeah. So call them up and say, yeah, I don't want to do it anymore. What is burial insurance? And I guess the other part of that is what in the heck is Ed, talking about burial insurance? Because again, I've taken hundreds of thousands of, Social Security claims, and a lot of those, unfortunately, were survivor benefits. And so I've seen firsthand what has happened, with people left after their loved one passes away. And one of the things is that $255 lump sum death payment, the burial benefit, $255. Come on. It's been the same for decades and decades and decades. So if you don't have other money, I recommend that you get some type of burial insurance, and you get like $10,000, $20,000, $30,000, pay a little bit every month. And that way, when you pass, um, you can, they can use that for burial or paying off, debts. Or I've had one person that came in, and I gave them the 255, and they said, oh yeah, my husband left us $10,000 when he passed away, and it's in a special account, and we take the entire family to Hawaii. He always wanted us to be happy. So his final thing was, he left 10 grand there, specifically said, buy plane tickets, go to Hawaii, hang out at the beach, and have a Mai Tai for me. So I thought that was pretty awesome. But I because of that, I put together a team that can also find a burial insurance plan in your particular area. So if you need it, but if you got a bunch of other money, then you don't really need a burial insurance and stuff. But if you don't, then it's a good idea. And then all you have to do is click the button that says more help on the very top there. And there's an option, a little link tree thing pops up, and it says, I want a quote for burial insurance. And you click that, and my team will reach out to you and tell you how much it is and all that good stuff. 61 years old, retired last year with a FERS pension. Worked for 40 years on my Social Security statement. FRA has projected pension at $3,800. That is very, very good. That is a very good pension amount. You must have worked a couple of hours in your life. All right. Private pension, thanks. I will be setting up a call to make sure I'm the right track. Okay, so yeah, private pension doesn't affect anything if it's not a city, state, or government. So it doesn't affect anything at all in terms of Social Security. That's what the Social Security system was never meant to be a sole thing. It was the three legs of the stool: Social Security, pensions, and your own savings. Unfortunately, defined benefit pension plans, the old pension, you work for 40 years, you get a pension and a gold watch. Yeah, unfortunately, those are kind of going away. Now it's pretty much your own steam. Did I hear you correctly about Project 2025? Going forward, you have to get a Medicare Advantage plan. No more option of Med Supplement or Medicare Advantage. Yeah, that's one of the proposals out there in the 2025 in the Project 2025 is they're going to make a Medicare Advantage the option, the automatic option that is kind of chosen for you is a Medicare Advantage. But again, that's Project 2025, and that's just a policy proposal plank. Whether it becomes reality, it's not reality yet. So, and as everybody knows that watches this on a regular basis, I always recommend Medicare supplement plans if you can fit it within your budget. And sometimes you're like, well, I can't afford that extra, $80 a month, $100 a month, $120 a month. So that's why they get Medicare Advantage. But with everything going on with Medicare Advantage, there are zero premiums now, but will they be the same in the future? And then you'll still have the, yeah. So the jury's still out on, and if you ever get sick, then usually the Medicare supplement is actually, depends on, with a Medicare supplement, like a Plan N or a Plan G, if you have cancer treatment, it costs $1 million, and you have Plan G, then guess what? How much you pay? $240. And then Medicare pays the other $999,900, whatever. Shouldn't they try to get medical records first before sending you to a consultative exam? Yeah, it really depends on the nature of the disability and everything like that. But they already have medical records. If you've already, if you've filed, they've already gotten your medical records. But some people don't have medical records, so they send you to a consultative exam because some people, don't have health insurance or never went to a doctor, and so yeah, there's no medical record, so they send you to a CE, a consultative exam, immediately. Do I need to do anything with the monies in my HSA before turning 65? And do I need to do anything with the monies in my HSA before turning 65 is the question. No, the money in your HSA is good. So you can keep it in there and withdraw it in the future and all that kind of good stuff. but you can't contribute to your HSA anymore once your Part A starts. And your Part A actually kind of starts 6 months retro. So 6 months before your Part A starts, you need to stop contributing to your HSA. And the problem is Social Security employees, because this is an IRS issue. It's because HSA is tax. It's a good tax way to avoid taxes, and it's really good. I highly recommend HSA. But because that's an IRS type issue, that's the issue. Social Security employees really won't tell you because they're not really trained on HSAs and Part A's and when you should stop and the 6 months and stuff like that. So a lot of people get kind of jammed up, that they still contributed their HSA and they start their Part A, and then they get a nasty letter from IRS and say, hey, you have to pay us this money because we gave you these tax benefits of an HSA, but you had Part A. And so and Social Security employees won't tell you because they just, unfortunately, they don't know. They're not trained on that. Spoken with you before. We'll be scheduling a call when I can. Your knowledge is much more given the effects to the rest of my life. Awesome. Yeah, everybody I've talked to on a personal basis, they're like, because I do charge, but everybody's like, yeah, that it's worth 100 times more than the little bit I charge them for. So I appreciate that. Taking Social Security at 62 and planning on adding spousal benefits same time spouse get his benefits. I will only be 65. Will I get half of his benefit? No, because if you start your benefits at 65, then it's going to be reduced. So let's see here. John Q in Sandy Spring, is there a program that will tell me the break-even point, take Social Security at 67 or waiting until 70? Yeah, online. MySocialSecurity.gov. It'll kind of tell you. And all you have to do is, it's pretty easy. I did a video on this. It's easy calculation. We used to actually do it when people came in and we say, hey, you can start your benefits now, or you can wait and get an extra $20 a month. But if you give you get an extra $20 a month, but you're giving up, 6 months worth of benefits, and 6 months of the benefits is, $12,000 or $10,000 divided by $50, and it almost always came out to like 14 years. So the break-even point is 14 years. So if you go through all your calculations and you come up to around 14 years, then yeah, that's usually what it is. But remember, yeah, from 67 to 70, because there's a lot more variables. The break-even point, there is whether you need the money, tax issues, you pay maybe less taxes now, so maybe you start your benefits, longevity in your family, are you healthy, do you want to use that money to take a vacation, pay off some other debt, and then figure out the break-even point calculation. So nobody can tell you. Every time I do a video that, hey, here's the reason you should take it at 62 or 65 or wait. And I always get comments down there. Oh, how come you're telling people? No, I'm telling, here's something you need to consider. Nobody can tell you when to start your benefits. Nobody. So, and well, there's one time, 100%, I did a short on this, and there's one time you will know 100% for certain. I can tell you 100% for certain when you should have taken your benefits. And that is on your DOD. Social Security says your date of death. So when you pass away, that date, I can tell you exactly when you should have taken your benefits. Oh yeah, this person should have waited till they're 70, 62. But because we don't know that date, just make your best guess estimate. And yeah, so there's that. Dr. Ed, I took my Social Security at 64 at 8 months. Will they automatically start Part B at 65? Yes. So about 100 days, we should have already probably gotten it. About 100 days before your 65th birthday, Medicare will send you a package with your Part B card and the Medicare and you book and all that kind of good stuff. So you need to start thinking about how you're going to cover those gaps. Medicare Supplement, Medicare Advantage. Find someone that you know and trust that can help you. Reach out to us, and I can have someone that's licensed and contracted in your state reach out to you and give you all your options. But yeah, you should receive. And however, you are also going to be everybody in the country, every health insurance company, and this Medicare insurance agent in the country knows you're turning 65, so you're being inundated. Everybody wants to take you to the turning 65, high school prom. You're the homecoming queen again. So yeah, you're probably inundated with stuff. And what happens is people get so much junk mail, and these companies make the mail look official, and you just start throwing stuff away because you get annoyed at all the junk mail. And sometimes people throw away the actual important stuff from Medicare, like that has their Medicare card in it, and they contact me 2 or 3 months later. Hey, I didn't get my card. And I was like, make sure Social Security has your correct address, and if they have your correct address, you might have received. And they always like, oh my gosh, I think I threw it away. So just call Social Security, and they will give you a new card, or you can go online and request a new card. And remember, your Medicare number is not the same as your Social Security number. It used to be, many years ago, your Medicare number was your Social Security number, which was stupid because Social Security always used to say, don't carry your Social Security number around with you in your wallet because you might lose it. But then you need to carry your Medicare number, which had your Social Security number. So it always made no sense whatsoever. So they finally fixed that. I worked for the FAA for 25 years, and in CSRS, I stopped paying Social Security in 1985. I have 16 quarters. The Social Security website already include my WEP reduction? No. Your WEP reduction isn't calculated until you provide the WEP letter from the CSRS. And the CSRS is the WEP letter says how much you're receiving, when you were first entitled, and when you were first eligible. So you need to provide that before you can do the but you say you have 16 quarters. So if you only have 16 quarters, you're not insured for Social Security anyway. Maybe you meant 16 years. So you need 10 years, 40 quarters. They say it was after 36 months and only the 1 month going over SGA. Yeah. So if it's past your extended period of eligibility, then yeah. So you can do the EXR, or yeah, just go ahead and work. And then if you can't do it anymore and you're outside of that 5-year EXR window, then unfortunately you'll have to reapply for disability benefits. If my disabled daughter claims under my husband's Social Security, will she lose her previous Medicaid coverage? It really depends on how much she receives. Medicaid is a welfare-based program. So if, she receives, $1,000, $1,500, $2,000 from her father's record, then that just might put her over on Medicaid. But there's a lot of exceptions on that for disabled children. So, and the states pretty much mandate you to file for any benefits you're eligible for. If you're receiving any type of welfare benefits, then you have to think of it from the states. And it's okay, we're giving this person welfare, but they have $2,000 sitting out there waiting. They just don't want to collect it because they're going to lose what? No. The welfare mandates you to file for any benefits you're eligible for. And if they find out later that you didn't, then they could very well retroactively, cause trouble. So I would definitely reach out to them. And again, say, hey, here's the deal. She's eligible for these benefits. We're going to go ahead and file, but what's it going to do to Medicaid? And then say, oh, it might be an exception in your particular state for that particular, issue. Purple Love, please hit the thumbs up button and share across social media accounts. Yes, please. Thank you. I know I should know this, but if I start Social Security benefits age 62, I know it's reduced 30%, correct? Does it increase when I reach FRA? No. Or will I be penalized 30% for the rest of my life? Yes. Yeah, once you're reduced, once you take a reduced benefit, then you're reduced forever. Scare quotes. If you continue to receive those benefits. If you stop receiving those benefits, then later your benefits are unreduced. But if you're taken at 62 and you get that 30% reduction and you continue to get your Social Security check until your full retirement age, then yeah, it's always going to be reduced for the rest of your life. And then there's another thing, an exception. There's called voluntary delayed retirement credit. So when you hit your full retirement age, you can actually stop your benefits and collect those voluntary delayed retirement credits, which is another 8% per year up until you're 70. And not many people do that. And so if you're interested in that, yeah, if you go down to Social Security, they won't know what you're talking about. They'll look at you like you're crazy. because there's not many people do it, so they're not trained. So you just have to provide the reference, and you can get it. It's easy. I'm divorced twice, but over 10 years, 20 years. What do I get part of that? How do I sign up? Yes. Yeah. Number one is you have to file for benefits on your own record. You have, if those people are, if your deceased spouses are still alive, if you're filing for survivor benefits, you don't have to start on your own record first. Um, but yeah, whatever one's the most money, you call up Social Security and say, hey, I want to file for spouse benefits, divorce spouse benefits. And they will ask you the information and say, okay, if you have the Social Security number, both of them, that's fine, that's perfect. But if not, just tell them the information. They'll find the record and they'll say, okay, number one, ex-spouse, you'll get X amount of money. Number two, ex-spouse, you'll get more money. So let's go for number two. And then you'll need to provide the marriage certificate and the divorce decree for that particular marriage. And remember, that could change. Then a year later, your first spouse passes away, and now survivor benefits, you get more. So many people losing money out there because they don't know how to kind of work the system. Yeah, so that's why y'all are going to share this and make sure people come in here and get all the money they're entitled to. My sister filed for disability, and it took 2 years. She didn't receive disability and received SSI $500 a month. Will turn 63 this year. Can she get Social Security this year? Also didn't receive her back payment. Yeah, no, that doesn't make sense because SSI is disability. She is not 65, and 65 you can get SSI based on an aged category that you're over 65. But she's receiving SSI, so that means she was approved for disability. So she is receiving disability. It's just SSI disability. So she was not eligible for SSDI eligibility because of she wasn't currently insured or she didn't pay enough into Social Security, whatever the case may be. But yeah, if she is now 63, and usually if she's receiving SSI, then Social Security usually already contacts you at 62 and say, hey, you're receiving SSI welfare-based program, and you have, $600 of retirement benefits out here. You're supposed to file for it. So she probably doesn't. Yeah, but call up and say, can she get any retirement benefits? But I'm thinking, unless you just didn't receive the letter, she didn't receive the letter, you moved or something like that. But yeah, usually they will stop your SSI because you failed to file for other benefits you're eligible for. So she might not be eligible for it. What percentage of taxes get deducted by the IRS from your yearly Social Security retirement? It really depends on so many variables. Yeah, I don't do taxes. I've been trying to cancel my subscription to the IRS for decades. My spouse is 67, working and receives Social Security benefits. I am 62 and working. Can I qualify for a portion of his benefits until I reach 67? No. You have to file for benefits on your own record, and you cannot file for benefits on his record until he actually starts receiving benefits himself. I see. My husband just passed away. Sorry about that. He was 66 years old, and we have a child together. He is 7. Yes, my son is going to get survivor benefits. Good. How about me? Do I get anything of taking care of my son? Yes, there's called surviving child in care benefits. So you can be any age, doesn't matter. But if you're home taking care of a child under the age of 16 or that became disabled for the age of 22, then you can get those surviving child in care benefits. But you are limited to the amount of work you can do, just like retirement. So $22,320. If you're making over that, they're going to hold back $1 for every $2 you go over. And there's also a family max, but survivor benefits is probably not an issue. So I would call them up again if it's the work is the issue. If you're making over $22,320, again, they're going to hold back $1 for every $2 you go over. But if you're not, yes, call up and file for surviving child and care benefits. And if they didn't address that with you, sometimes they miss that. They forget to talk to you about it, whatever the case may be. And your child has been receiving benefits for 1, 2, 3 months. Say, hey, I just learned about this child and care benefits, and how come you didn't talk to me about that from day one? I want my money from day one. So I want you to give me all that back pay for when your child, son, daughter, your son, when your son started benefits. So if your son started benefits 3 months ago, you should have conceivably also started your child and care benefits. So tell them to give you those back pay, back money. Can you apply for Social Security benefits on your spouse's record without activating your own Social Security record? No, unless your spouse is deceased. My income is less than $13,000 a year. Will my disability benefit back pay and or retroactive pay taxable? Yeah, again, I don't do taxes. Just too many variables there. Let's see. Once I start getting, we start hitting here and, uh, we get a lot more viewers and all this kind of stuff. Then my future is I want to bring in definitely another Social Security expert, so that be able to help you all out. Right now, it's just me, and nobody that retired from Social Security wants to talk about Social Security again. So, having a hard time getting help with that. But I also want to bring on somebody that helps with taxes, an IRS type of person, maybe that works with the IRS, someone that helps with VA and stuff like that. But yeah, that's where I'm going in the future. But right now, just me, myself, and I, and my awesome son, and the Medicare team, burial insurance team, Obama. But those are not; those are uh, kind of network that I use. Good evening. I'm an adult caregiver for my parents. I need to learn more about Medicare and Social Security. What websites, program, resources, etc., to learn about this locally in person? Locally in person, yeah. Ooh, I mean, I've got over 600 videos, so anything you need to know on all things Medicare, Social Security, I guarantee there's a video for that I've made for it. Probably 10 videos I've made for that particular subject. What happens when you never use your SSDI? Yeah, then you've never became disabled and never got your Social Security disability insurance. Um, yeah. What questions should I ask Medicare and Social Security companies related to Project 2025 if it passes? Um, yeah, it's just those are policies of the Heritage Foundation, which most of those people that wrote it had connections, worked in the previous White House. So yeah, nothing so far. Um, and that's what one of the scary thing is about Project 2025. It mentions nothing about Social Security solvency and what to do to shore it up in the future, because we need to start fixing that thing now. Yeah, so it's strange that Project 2025 has over 900 pages, but it doesn't talk anything about Social Security solvency and how to, make sure it's there for our kids and grandkids. So that was kind of scary. And the Medicare part was, Medicare Advantage, a default option. So, can a permanent resident senior citizen, 80 years old, who is eligible for SSI, can a permanent resident senior citizen is eligible? Yeah, you don't need to be a U.S. citizen. You just have to be in the country legally to get SSI. Permanent resident, absolutely, 80 years old, eligible for SSI. If you have Medi-Cal, you probably qualify for SSI. SSI, yeah, the welfare-based benefit, and you get SSI, supplemental security income, um, based on a disability, or if you're 65 and older, you can get it as called aged SSI. So I would definitely call Social Security and apply for SSI. And if you're getting Medi-Cal, I'm surprised they didn't already set you up with that. But SSI, just like Medi-Cal, which is California Medicaid, is a welfare-based program. So they're going to ask you about your income and other resources and stuff like that. So yes, but please call up Social Security immediately, if not sooner, and apply for SSI. Let's see. EW's, I guess Elizabeth Warren's new bill tries to give subject matter experts ability to make agency decisions again post Chevron. I'm happy it's her. Oh, okay, that's good. Yeah, I don't know how she's a legislator, so yes, if she makes a law to that effect, if and it passes through the House and Senate and it's signed by the president, then the Supreme Court really can't say anything unless they come back and say that's unconstitutional, which that would be a far stretch. So yeah, that's I'm definitely have to check that out. Thanks for the heads up. Um, Let's see. Can you explain RSDS benefits and is it the same as retirement Social Security? RSDS, not sure what RSDS is. RSI is retirement survivor insurance. Not sure what RSDS benefits are, but that's not the same as Social Security because I don't recognize that acronym and I know all the Social Security acronyms. So that is not Social Security, whatever RSDS is. So um, I am 51, fully disabled, collect SSDI. I was married 11 years, divorced 5. I'm 61, he's 58. Can I collect on the divorced spouse at 62? With my disabilities, can I collect before his 62? No, he has to be 62 and you have to be 62 and then you can collect spouse benefits. But yes, good knowing that. There's so many people out there that again that are losing money that are on disability and then they turn 60 years old. I did a video on this. If you're on disability and you turn 60, check to see if you're entitled to any survivor benefits because survivor benefits start at 60. If you're on disability and you turn 62, see if there's any spouse benefits because the spouse benefits start at 62. And then when you turn 65, remember to check out the Medicare supplement plan. But if you get survivor spouse benefits or divorce spouse benefits and disability, your disability is still going to stay. You're still going to have disability. You're just going to add money on top of that. So you're still going to have disability. You're still going to have Medicare and all that kind of good stuff. You're just going to get extra money based on surviving spouse or divorced spouse or whatever the case may be. So yes, a lot of people say, "Oh no, I don't want to get surviving spouse benefits because then I'll lose my disability and then my Medicare will stop." And ah, tens of millions of dollars, hundreds of millions of dollars lifetime benefits out there being lost because people don't have the information. So please share. I started Social Security at 62. How much will SSI be reduced when I apply when I'm 65 in 3 weeks? So SSI is a welfare-based program. I started Social Security at 62. How much will my SSI be reduced? Well, if you're questioning, if you're actually asking about SSI reduction, the welfare, the most you can get on SSI is $943. So if you get X amount from Social Security retirement, it's going to be reduced by that amount. And you can only get $943. I'm assuming you're not talking about SSI, the welfare-based program. When you apply in 65, it's not going to make any difference because you're already receiving Social Security. Your benefit won't change. You're probably just talking about Medicare or something. If I want to wait until 65 for my benefit, can I ask for the 50% benefit for my ex-husband as soon as I turn 62? No. My ex is already 62 receiving his benefit. We were married 10 years. No, you have to file for benefits on your own record because he sounds like he's still alive. And then you file for benefits on his record and you'll receive up to 50%. You'll receive 50% when you start your benefits at your full retirement age. What would be the best way to opt out of Part B? I'm disabled veteran and have VA medical for life. Yeah, I would definitely make that decision very carefully. And, you know, a lot of people are happy, and I'm an old Marine Corps sergeant, so I help a lot of vets. But you're happy with the medical center, but what happens when you move and there's not a medical center nearby or the customer service goes down or you want to get a second opinion and you've lost Medicare. So there are other options. So you can, disenroll from Part B, but if you ever decide to re-enroll it in the future, you're penalized for the rest of your life. So there are other options. If you're having a hard time paying for Part B, contact state Medicaid, see if they'll pay for your Part B for you. If not, there are Medicare Advantage plans called Part B Give Back that are directed specifically to people like you. They're called Honor plans or Patriot plans, and they pay for part or all of your Part B premium. So you can have your cake and eat it too, because after all, you paid for, Medicare, FICA check, charges all your life. So that's where that money comes from. It's your money, and so might as well get it back. And if you want help, again, reach out. I'll put the link down there again. If you want someone to reach out to you and see what's available in your area, see if there's those Patriot Honor plans in your area, and yeah, they will be able to help you out. Oh, Mr. Reed, thank you very much for the support. $5. Thank you. That's my coffee IV for the day. I really do appreciate it. Let's see. Oh, and so I applied for SSDI in Latin America for my initial application on phase 3, and it's going on 8 months. Is it normal for taking this long? Unfortunately, yes. Unfortunately, yes. It's Social Security is a 27-year low in terms of staffing, and yeah, they're having a hard time. But 8 months is you're coming up to the limit. Um, so yeah, you should. I would reach out. It's not in your Social Security office anymore, wherever your Social Security office is. It's at the DDS, the Disability Determination Service, which is a state agency. So I would reach out to them and say, "Hey, hello, what's going on? Are y'all looking to make a decision anytime in the near future?" So hopefully they will say, "Yeah, we're about to make the decision." But hi, Dr. Ed. I was approved for QMB Medicare assistance today. Awesome. I need to be on a Medicare plan by August 1st. I'm lost about the dual eligible plan to choose. I'm in West Virginia. Yes, Ray, call us up. I can have someone reach out to you. I've got people contracted and licensed in West Virginia, and the QMB qualified Medicare beneficiaries. So Medicaid is going to pay for your Part B premium. That's awesome. So now you are eligible for a Medicare Advantage dual eligible plan. And I usually recommend Medicare supplements, but in your case, Medicare Advantage all day long. Medicare Advantage dual eligible, because that's pretty much the only thing you can sign up for. You can't sign up for Medicare supplement, even if you wanted to. So Medicare Advantage dual eligible. So you'll have Medicare, you'll have Medicaid, you're going to have the extra help with the prescription drugs, and you'll have Medicare Advantage dual eligible, and then hopefully they'll be able to find you one of those grocery cards or rent assistance, or all the different dental and vision and stuff like that. The dual eligible plans usually have a lot more benefits than other regular Medicare Advantage plans. So click on the link. There's a category where it says I one-on-one Medicare help, and put in your information, and I will get that to my team immediately, if not sooner, and they'll probably give you a call tomorrow. Just yeah, and within tomorrow, they'll get you set up by August 1st. No problem whatsoever. Awesome, awesome, congrats. Thanks. I did mean 40 quarters. I appreciate it. Okay, yeah, I figured you did. We have Family Max. I am the PIA. My wife never worked. My disabled stepchild is with us. What happens if my wife passes away? Will we keep the Family Max with my stepchild? Yeah. So if the Family Max it's only counts the people in the household. It doesn't count divorced spouses and stuff like that. So if you're coming up against the Family Max, you've got a child in care benefits and your benefits, and 2 children, then there's a max that can be paid out. And what they do is they take it and divide the max by 5. But if one goes off because they turn 16 or whatever the case may be, or 18, and then there's still a max, then they take the max and divide it by 4. Or depending on the max, you might actually get more. So Social Security will have to do those calculations for you. Can I reapply for SSI after being denied? Absolutely, 100%. Yes. All right, we are over an hour, and let's see. Let me get to 2 people I've never. Let's see. That I've never seen here. I have called your 800 number, left my info, no call back. Yeah, if you called about a Social Security question, then I've sent you a text message that says, yeah, I get hundreds of calls every day, so I can't, unfortunately, again, it's just me. So I can't call you back, but I sent you a message that, you can go on, you can come here and ask your question here. I do, these live Q&As pretty much every day. And this is 100% free. If you want to schedule a private appointment, then you can do that. But if you need help with, signing up for Medicare, burial insurance, Obamacare, then I have people that can help with that. But if you called asking a question about Social Security, then this is the place to ask it. And so please, Hapri, type it in there immediately. This is the last question I'm going to do. I'm going to answer this one question. So please type your question in there right now, and then I will answer it. I don't skip. Oh, it's about an FPO address. I answered a question about FPO address yesterday. Is that the same one where you had an FPO address and you couldn't get your mail or something like that, or you couldn't file online? Yeah, I answered that one yesterday. So, see, I didn't skip over you. I do skip over people. That my little screen that I have here, and yeah, it's not the best, but it is what it is. I turned 65 in May 2025. How soon should I get with your brokers to get Medigap? And should a person get several quotes from different brokers? Can you tell us a little about your bro? Yeah, that's the entire intent of that's why I only deal with brokers. So you have agents, captive agents, and they only work for one company. And so it's like the old Henry Ford. You can have any color car you want as long as it's black. So if they work for one company, guess what they're going to give you is that one company. A broker is contracted with several companies in your area, and they get your information, your doctors and your prescriptions, and what you need and your budget and all that kind of good stuff, and then they base that and they say, okay, all right, let me go out into the market and see what's available in your area. And then they come back and they say, here's one, two, three, or four of the best plans in your area, and then they give you the good and the bad of all of them, and then you make the decision. So yeah, that's why I only deal with brokers. So if you in May of 2025, around January, February, yeah, reach out to us and we can have something go over all your options. All right, let's do. I recently had a car accident and I had to apply for disability, and I was only 3 credits away from getting SSDI. Ouch. How long would it have taken me to get those 3 extra credits? A day. It's, you get credits based on work. And it used to be different where you had to work during that quarter and stuff. But now, there was a credit this year is what, 1,700 or something. So if you work 1,700 times the 3, then yeah, you will get, yeah, a quarter of coverage is $1,730. So you need to make $1,730 times 3, and that'll get you those 3 credits. All right, let's see. Okay, I'm going to do one last one here. Christine, I retired early and could not benefit from my ex's since I had earned over half his income. Yep. I'm now 65. He has retired. Should I review my benefits? Yeah, because if he continued to work and pay into Social Security and you didn't, and because you retired, then his benefit amount, his PIA, his primary insurance amount might have gone up, and it's probably not going to go up very much. But hey, a buck's a buck's a buck. And the benefit of that, full disclosure here, the benefit of that, and you're like, well, it's only, I only get $2 extra. But if he should pass, then if you're on his record as a spouse, you won't have to do anything when he passes because you're already on the record, so that it'll automatically switch from a living spouse benefit to a surviving spouse benefit. So some people do that, and in order to make that transition at that difficult time, you don't have to deal with the government bureaucracy. Everything is automatic. His people's passing is automatically reported to Social Security. Their last check is taken out or stopped, and any spouses on the record automatically get switched over to a surviving spouse, and they also get that lump sum death payment of $255 automatically. So there's that. All right, that'll do it for today.